So when I see a fluid collection, what am I really appreciating? Well, deep below the abdominal wall, I might see that free-floating fluid. It's nice and anechoic. I might see the tip of the solid organ, like the liver or the spleen. But when I'm performing the procedure, I want to make sure I'm well away from those solid organs, more down towards the lower quadrant. So that fluid is anechoic. I can evaluate for where my needle insertion site is going to be, what the depth might be to reach that point. And I can see if there are any other structures in the way, if there are any adhesions or other things that might impede a successful aspiration of the fluid. So this is typically what I will see in one of our patients with ascites. Kind of reminds me of a lava lamp with a bowel kind of bubbling up through that acidic fluid. But here we have a nice large volume. This is exactly what you would like to see before performing your paracentesis. A really nice deep pocket here with no bowel really anywhere near it, in which you can safely bring in your needle tip. So if we were to find a nice deep pocket and measure it in this case, look at that, almost 7 centimeters down in this particular fluid pocket to the area where there would be bowel. So you could just do an X marks the spot technique, get out your surgical sterile pen, mark the spot, or use another method for marking, and then put the transducer side, prep, and just go. But why not? We've got ultrasound, we've got sterile sleeves. Let's go ahead and use live dynamic guidance for this procedure. So with real-time guidance, it's going to be important to have that sterile sheath back. And you can choose either to keep your curvilinear transducer, or once you know where you're going, why not switch over to the linear array transducer to have the better needle visualization? I prefer the in-plane approach where I can see my needle pathway entering into that acidic fluid. And it's going to allow for some nice direct visualization, and I can make sure my needle tip is not encountering any other structures like the bowel. And then at the end of my procedure, I'll keep the probe in my sterile field so that I can go back and apply it on the abdomen and make sure I was able to get out a significant amount of fluid. Sometimes the fluid stops coming and you're thinking, gosh, it seems like there's still plenty of fluid left in the belly. And you have to go back and reassess where that catheter location is and make sure it's not stuck up against the abdominal wall or that something else is not preventing the drainage. So we can set the procedure up so that the machine is in plane with our vision, and we don't have to glance behind ourselves. Nope, just simply look up and watch the visualization of our needle tip as it's going in plane. You can see we've got our surgical towels, a nice prep draped sterile field. We've got our sterile sheath, and we're ready to come in with our needle tip. And then using a linear array transducer, this is what it will look like when you puncture through the abdominal wall to see your needle tip. And this is our acidic fluid and our bowel down just below. And again, just showing you that nice echogenic needle tip entry through the soft tissue into the acidic fluid. And then once you're there, you can set your transducer aside and proceed in the normal fashion for performing your paracentesis. One thing I will mention is the initial ability as you're pre-scanning to use that linear array to also identify the blood vessels in the abdominal wall, that inferior epigastric artery. You can mark where the location of that artery is so you can avoid causing a hematoma during your puncture of the abdominal wall.